A lot of women within a year of getting on birth control will be on an antidepressant or an anti-anxiety medication.
No
And
way.
no one makes that connection. Birth control really suppresses our hormones. So it
Mm.
actually just like disconnects the brain speaking to the ovaries.
What are something, if you're seeing a ton of acne, is that something that is specifically gut health, or is that also an imbalance of their hormones?
The skin is really a reflection of what's happening internally.
Interesting.
So eczema, psoriasis, the gut is the first place to start with that every single time.
Welcome back to the Long Game Podcast. Today we are thrilled to have our personal doctor, Dr. Julie Taylor, join us. Dr. Taylor is a leading expert in functional medicine. Since starting her practice in 2014, she's been helping patients achieve optimal health with a deep focus on hormone balance, gut health, and nutrition. She's completed her residency in preventative medicine and earned her master's degree in public health at Loma Linda University, known as one of the world's blue zones. In this episode, we'll talk about how she's helped us with Poppy's gut health, and Dr. Taylor will share some simple tips you can try at home to make meaningful, long-term changes. Join us as we dive into her insights on health and wellness.
Dr. Taylor, we found you going through our story with Anthony, prediabetes. Once we got our blood work checked, we discussed this more in a previous podcast episode, if you guys want to check that out. But through all this, we found Dr. Julie Taylor. She's local to where we live in Pasadena, and you came up really high on all Google reviews, and I love that you're a female doctor. And I've just been loving our relationship, getting to know you more. Can you tell us quickly what the difference is from functional medicine to traditional medicine? I feel like the biggest difference was the time spent with us, really trying to understand our story and trying to understand our health, not just reading off the checklist quickly. And that was a big difference for me, that I really fell in love with the whole idea of functional medicine.
Yeah, I mean, I think in medical school, we focus very much on big pharma and how big pharma can treat symptoms. It's really symptom management. That's how we as MDs learn how to treat patients when we come out of med school. And so when I was in med school and residency, I realized pretty quickly that that's not the way that I wanted to practice once I got out. So the difference really between functional medicine and conventional medicine is pretty basic. It's conventional medicine is really about treating symptoms from a medication or surgical perspective. Functional medicine is all about getting down to the root of the cause. So what is actually causing your symptoms? What's causing your headache? What's causing your difficulty sleeping? What's causing your anxiety, your depression, all of that? Because our body's a system, like everything is connected. And in med school too, I think we learn about, there's specialists for everything. There's a neurologist, there's a gastroenterologist, there's a cardiologist, there's an endocrinologist, but really the whole body is completely connected. So functional medicine looks at the whole body, the whole person, and how to fix the root cause and thus fix the symptoms.
When you see people coming in, are they normally coming in because they didn't find what was going wrong with them at a conventional medicine, or is it someone who's being more proactive and preventative?
Like, is it a last resort,
Yeah.
or are they being more proactive and they're very knowledgeable on what they have? But we're very curious on what's that mixture.
Yeah. I mean, I think it's a lot of just their own individual research. I think most people are kind of fed up. Like they've come to the end of their line of conventional medicine. Maybe they had some major event that happened. Maybe they almost died. Maybe they had a heart attack, a pulmonary embolism, whatever it is. And now they've done the deep dive of I don't want to be on big pharma forever. And now I have a new lease on life and I want to figure out how to be as healthy as I can be. I see a lot of menopausal patients. For those people, they've been to their gynecologist, they've been to their primary care physician. They don't want to go see a psychiatrist and get put on psych meds just because they're feeling anxious, and they know that it's something. So they know that it's hormonal changes, and we put so much emphasis on our doctors and what they know because we've been to med school. We've gone through all the education. We should know how to help people feel better. That's our job, right? And so I think that, yes, most of the patients who come to see me, they're kind of at their wit's end and they don't know what else to do. And somehow they came across functional medicine. Maybe they listened to a podcast. maybe they talked to a friend who said, hey, there's another way, there's another approach. I think that's a lot of people. And then I think there's the other subset that like they're just healthy wellness people. They barely use their conventional doctor for anything. They're always looking for a wellness doctor. And people come across me that way too. But I think for the majority it is that they've gone to the end of their rope.
Yeah.
Yeah.
Unfortunately.
You've been helping me so much with Poppy and her gut health. And before we really dove into this, before last year, I did not know how negative antibiotics were. I was before one of those people that would take them just in case and had no concept of how terrible that is for gut health. And Poppy, before we saw you, she had been on 2 rounds of antibiotics and could not get rid of that cough. I was like, it's something else. So I had stumbled into gut health. We were already meeting with you. And then I was like, what can we do about Poppy? And she was eating really healthy besides the antibiotics that wiped everything out. Can you share a little bit for a mom at home?
And I think also expanding on the importance of gut health. I mean, we had no clue. And once we started focusing on, okay, how can we optimize our gut? I started to notice when my skin, I had chicken scratch or whatever, not eczema or...
We didn't know what it was. It was just these little red bumps.
I've always had it my whole life. And when I started focusing on my gut and changing my eating habits, it completely went away on its own. And so that was a light bulb moment where, wow, the gut is very important.
The gut is the center of everything. Like Hippocrates said, like everything starts in the gut. Think of all inflammation. Inflammation is really the root of all disease. If you think of cancer, you think of Alzheimer's. Inflammation is really at the core of that. And inflammation starts in the gut. So I feel like the gut is really almost always the first place to start. It has to be at the root of what we do to heal people.
Yeah. So one of the things that we did to optimize Poppy's health is I cut out gluten. I would say we were very low gluten. Like she had pumpkin pie the other night on Halloween and there's a crust on there. So it's like here or there, she'll have it. And we also have sourdough bread. But overall, it's been pretty easy to do it because
there's very easy swaps.
One thing that if someone had their toddler on antibiotics, what are the ways to build up that gut health again? And some of the ways that you helped me with Poppy too.
Yeah. I mean, I have some really great supplements that I use in my office, but I think if you don't have access to all the things or all the testing, a really good probiotic I think is key. And I think not jumping to antibiotics.
Right.
You know, that's really important. I think even just entering into like the winter season, you know, just because your child gets a sniffle or has an earache or has a cough, a lot of that stuff resolves on its own.
And it's so interesting since having this whole mindset shift of antibiotics, Poppy has not been on antibiotics since. And typically she hasn't really been as sick as much either.
No.
But if she would have before, I would have, I got to take her in. I got to immediately get her on something. And just shifting my mindset into pumping up her immunity, making sure she takes glutathione, and she's eating as many nutrient-rich foods as she can.
Yeah.
I'm trying to do a more preventative aspect and making sure she also is on a probiotic. What do you think of the seed probiotic? She's on the pediatric one.
Yeah.
And we also take the seed for us too.
Yeah. I mean, I don't have a lot of familiarity with that one, but I think as long as it's broad spectrum
it is.
And, you know, doesn't have all the fillers and things like that in it, it's probably a good one.
Yeah, it doesn't have any of the. Yeah, because that's the other thing. It could be, you can have a bunch of sugar with your probiotic.
Yeah,
it's kind of not doing anything.
How do you feel about flu shots? Because I know that's a big thing where doctors try to push that on you. And, oh, well, it's flu season. Got to get your flu shot. I
don't do them for my family, and I don't typically recommend. I mean, I think that the toxic burden just from all of those vaccines, that's a whole other topic of conversation. But if you're healthy and eating well and sleeping and taking things like glutathione and detoxing, I don't think you need extra vaccines, you know, like I really don't.
I think that was our big mindset shift is just building up our immunity and having our defenses, being able to work how our system was designed. What tip would you have for someone who's listening that may have gone to see their doctor and they're not taking them serious? Like listening to your gut is also really important when you know your body, you know how you feel. And if you don't feel great and you're constantly being told, oh, that is normal for you, What would you recommend to do in that situation?
Find a new doctor.
Find a new doctor.
I have this book coming out next year. And so in that book, I talk about how you have to find the right person for what you're seeking out. So you're not going to hire a plumber to do your electrical work and vice versa. So if you want somebody to find the root cause and to actually help you heal and to prevent disease and to reverse disease, which is my entire background, you have to find someone who is trained in that.
Mm-hmm.
You can't go see your like regular primary conventional doctor who's all about medication and think that you're going to get another answer. Their tool is literally their prescription pad.
Mm-hmm.
But you kind of have to seek out someone who understands functional medicine and understands root cause and wellness.
Right.
And I really love the approach every time we come into your office. I mean, we're always there for over an hour,
Always.
really explaining the situation, going through the labs and really trying to figure out what is the best approach and how can we get rid of, whatever we are facing.
Do we want to talk about what we're going through right now or no?
We have mold.
We have mycotoxins. We don't want to laugh about that.
It's just a funny situation. But yes, all of us in our family, we're still trying to figure that out. But we have mycotoxins. We all have mycotoxin poisoning. And each of us have a different one, which is really random because we all eat the same thing. We all live in the same place. And we had our house tested and there wasn't any indication of mold there.
So we're getting a second opinion. We found this because on my blood work, there was a sign of inflammation. And that was strange because I'm eating really well. I'm working out. I'm doing all the things and I was thinking maybe I was a little run down or sick when I took the blood test. But Dr. Taylor said, well, we should probably just do a mold test just to clear that aspect out. So I got the test back and was really shocked to find that I don't even know what it's called, the OCA or ochratoxin.
Yeah.
I'm actually going to be talking to a mold specialist in the beginning of December, the one you recommended. So she recommended a list. You followed up with me afterwards like, okay, we need to dive further into this, figure out where the source is coming from and see how we can, basically our house wasn't tested the correct way, our rental house that we're in. So more to come on that. But how does mold affect? Like that's what I was going through, the spiral of like mold. A lot of people are probably walking around with mold.
We have no symptoms
mycotoxin.
either.
I have no
so
symptoms.
Right.
If you didn't test for it, we would have never known.
And it can lead to, it says infertility, Alzheimer's, all the list I was reading why you want to detox yourself of these mold toxins. I was shocked by it because obviously my immune system is suppressing it.
Do you think it's beneficial for someone to do like a yearly mold test just in case, or should we wait?
I think it's a little nuanced. Like the way that I approach patients, everyone's individual. So how I treat one person is not how I treat the other. I think you guys are kind of unusual because you don't have symptoms, right? So we kind of did it because your lab showed one thing and then we went down that path and got mold testing. I do think there are a lot of people walking around with mold that don't even realize that they have it and they're facing all these symptoms, whether it's foggy thinking or joint pain or headaches or something like that, and they've never been tested for mold. And if they go to their conventional doctor, they're not going to be tested for mold.
No.
So I think it's very individual. I don't know that everyone necessarily needs to get it all the time. I do think that probably every year people need to get their gut tested. So that's one thing that I think is super important.
For a gut test, what are you looking for? Can people do that at home themselves?
So for the gut test, I do 2 different tests to comprehensively look at the gut. So one is a breath test. That one tests for SIBO, which is small intestinal bacterial overgrowth, which basically is exactly what it is, what it says. It's the overgrowth of bacteria in the small intestine. We're not supposed to have a bunch of bacteria in our small intestine. But that causes bloating and acid reflux and like indigestion and kind of things like that. It's very easily treatable. So
how do you get that in the first place? The overgrowth of you just like
antibiotics,
eating a bad diet,
toxins,
Processed food.
Even as a kid, kids can set themselves up for having poor gut health,
right?
Which leads into hormonal imbalance as a teenager. Which leads into all sorts of issues, in their 20s and beyond. But I think focusing on the gut, even as a child, is super important. And we don't put emphasis on that. Ever, right? And
The
then
kids' meal every time we go somewhere is terrible. It's fries and
yeah,
something fried.
yeah.
It's just sad because it's supposed to be building their immunity up and prepping them for adulthood and also building their habits. But if you're
Yeah.
constantly just giving them fries all the time, that's all they know to eat.
And then the
So-
other test that I do to be comprehensive about the gut is I do a stool test. And again, it's just like an at-home test. And it tests for parasites and tests for leaky gut and tests for inflammation. It tests for yeast, which
That's what we did for Poppy.
Yeah. So that's how I comprehensively look at the gut.
And then you were able to see how diverse her gut was, the
Uh-huh.
microbiome, and which ways we could support in other areas. And I thought that was such good information to have.
Yeah.
And
I mean, it told us that Poppy was not getting enough protein.
Right.
Even though she eats protein during dinners. And
we really prioritize it after that. And I would say she's so thoughtful. She's so calm. And I really do think it has to do with she's getting enough sleep. She's eating the right foods. She's probably one of the only kids that didn't have candy on Halloween. She didn't even know, though. She never had candy. I was like, we're going to come back and have pumpkin pie and ice cream. We're going to go and look at Halloween decor.
Amazing.
And I made it all about the experience versus
Looking
the
around.
candy.
Yeah.
So she was looking at the costumes.
was
People would say
empty.
trick or treat
Yeah.
and she would wave. I'm like,
Oh my gosh. That's amazing.
overall, though, I would say she eats to where we're trying to build up her immunity.
I think for us, we've tried to focus on vegetables or salmon, but I can see where that issue is where, well, my kid doesn't eat vegetables or my kid doesn't do this or that. When someone comes into your office, how are you able to tailor that approach and introduce some new habits? And have you seen success with that?
Yeah, I mean, that's why I have my functional nutritionist who works with me on my team. So she comes and she helps see patients and helps put them on, a certain protocol. But diet is so key. And I'm not perfect. I mean, I have 3
And no
kids
one is.
and they're all over the map. But, prevention is key. But also, if your child has something, they develop whatever it is. We could talk about ADD, like headaches, difficulty sleeping, outbursts, kind of personality changes, early onset puberty. I just had a 7-year-old came in. Mom's concerned about early onset puberty. So, I mean, there's so many things that happen with kids that can be reversed, So I think that those are some things to think about. But I'm not perfect with diet with you could probably help me.
No.
With my teenagers.
I think it's easier when they're toddlers.
Yeah.
Right? I mean, we have a big fruit bowl that she can grab without having to ask, but she can't reach the cupboard to go up or the fridge. She doesn't know how to do all that. But yeah, Jaden's a whole other thing.
Yeah.
That's Jaden's.
I would say Jaden eats way healthier than she did a year ago because
she has
when
no
we're making
options.
food at home and she's eating what we're eating.
That's fine.
I
You're going to be
know.
out on your own and you have your own decisions to make. We just try to give you the information and however you take it.
I want you to be equipped with the information and you can make your own. Jaden's off to the side for those listening at home.
Yeah, we thought this was an important episode for her to listen to.
What are some of the things you see when you help your patients?
People having major shifts in how they feel. Like that's always kind of the most rewarding. And it's really those people who probably have been to all the doctors, all the best of the best or whatever it is. They're so frustrated. And I'm like their last hope.
No, that's so good that they're taking it into their own hands because I always say you have to be the CEO of your health. And if you are not feeling heard by your doctor or feeling that someone is looking out for you and really rooting for you, then you have to make those decisions. And if it's stopping that relationship, get a second opinion. I know one thing that's helped with us is instead before we'd have our insurance that was for just a standard plan, but we moved to a different plan to where we can have more of emergency insurance and we're still budgeting in the way for health and wellness, but instead of paying that insurance premium each month, it's been a good tip for us.
We just did the same thing. Which I'm a little nervous. I'm like, okay, nobody
because I
break
think
anything.
No, but I
right?
think what conventional medicine is really good for is if you have a surgery or you need that some life-saving
Yeah.
You're in a car
intervention,
accident.
right?
Yeah,
That's
something.
catastrophic. Right.
That's amazing. You want the best surgeon on your team.
Yeah.
But I think for the day-to-day, you're going to see these surgeons for these questions. And I just don't think that's the best. It hasn't worked for us. So this is why we've prioritized shifting how we're spending that money throughout the year
Yeah.
and thinking of it from an
Proactive.
emergency.
Yeah.
Like we still have the insurance for if there's a surgery needed or someone
Yeah.
breaks a bone.
Yeah.
Cool.
I mean, look, the US is not about helping people to be as healthy as they can as they age. Like that's not our approach. Our approach is getting patients on meds early, keeping them on them as long as possible. So if we can get kids on meds, that's actually like
So
the best thing
sad.
for big pharma because that's just it's like a shoo-in and they know that they have that person for the next 7 decades. Going to your doctor and expecting something different, expecting that they're not going to give you a medication or not refer you to a specialist, that's not what you're signing up for.
Yeah.
Especially if we have a history, last 5 years, okay, how many times did we actually go to the doctor? Or what are the preventative measures we're doing now? And I think it's just you have to reevaluate every year. Every year I reevaluate our health insurance. I'm like, okay, well, this was a plan that I did not need. Let's go to a lower one. And now we're switching to this other plan, which cut our savings in half. But then we can use those funds to be more proactive and do those day-to-day changes to keep us healthy. And
What advice would you give to someone who's maybe a teen or in their early 20s who doesn't know if their hormones are where they're supposed to be? Because I know when I was in high school, I had super, super heavy periods. And the advice I got from my OBGYN at the time was to get on birth control and it helped clear my skin.
Yeah.
But I felt terrible on it too. I was on it here and there. I never had a good experience with it. Why is that something that they jump to? I just assumed you got on birth control because your period is heavy, and that is such a backwards mentality.
And I mean that really is the solution for teenagers with any period issue, any sort of skin issue, just put them on birth control. And birth control really suppresses our hormones. So it actually just like disconnects the brain speaking to the ovaries. So you've completely cut that off. And now you are pumping your body with synthetic hormones and you're just masking all the symptoms. A lot of women within a year of getting on birth control will be on an antidepressant or an anti-anxiety medication.
No way.
And no one makes that connection.
Oh my God.
I have so many patients who are like, oh yeah, I've been on this antidepressant for like forever, like for 30 years or whatever it is, 20 years. And it's often after they start birth control because it suppresses our progesterone, which is our own natural antidepressant. And that causes anxiety and depression. It's the same hormone that causes postpartum depression when like post-delivery. If that's the answer is to just be on birth control, again, I think you need to find someone who understands hormones and understands gut health. Diet is probably super key, right? Like if you're pumping your body with like a lot of dairy and a lot of hormone related foods, then you're going to negatively affect your hormones. Stress is key. Gut health is key. I mean, there's so many things for teenagers that I think is so important that if they are having symptoms, that a lot of that stuff needs to be looked at.
and I always am on Jaden about her sleep because I know teenagers need more sleep than even adults.
Yeah.
And the school, how they start so early, that's a whole other thing. But it's crazy for how early they expect the kids to be there and then also have homework after school. There's a lot on their plate for being teenagers, and I totally get that. And prioritizing sleep is sometimes the least of things to get prioritized.
Yeah.
What about someone like me who, well, now I use the natural cycles on, have you heard of that with the Oura Ring? And they track your cycle. It's pretty interesting. It tracks it from
Based on your like temperature.
Yeah, so it tells when you're most likely fertile, and it's actually really cool. But someone who maybe is prepping their body to want to be pregnant one day, what are the best things that you would recommend if someone came to you and felt like their hormones were all out of whack?
I mean, I do testing. That's kind of like the beginning, right? Like, so I spend an hour with my patients. We go through everything and then determine like what testing they need. So often it's hormonal testing is kind of like the first thing that I'll do for women, especially if they want to get pregnant. That and diet is probably the first approach. And I think just, like balancing out their progesterone and estrogen is really important. So a lot of women, their progesterone's too low, their estrogen's too high. And even if you do get pregnant, miscarriage within that first trimester is common with hormone imbalance. But that's not really something that's addressed or looked at or balanced beforehand.
How do you balance the hormones? Because Remember when we got yours tested, you had high estrogen. So that was very strange. You were on the estrogen blocker?
Mm-hmm. I think I was on an estrogen blocker, but then they also gave me like a supplement to increase the connection between my mind and my pituitary gland. Or
Clomid, probably, maybe something like that.
Yeah, exactly.
Oh, Baxter on that. When he first did his blood work, his testosterone was very low. And so
it was like 200 to 300, low 300s. And now it's up to 800. But yeah, I did have that issue where it was just converting way too much estrogen. But I think that just goes into.
But how much better you felt afterwards?
Because you think when we get older, we have kids, we have our jobs. You just wake up every day tired thinking this is the new norm.
Yeah.
Like I'm not going to feel like I was when I'm 20 because I just have all these added responsibilities. I'm just trying to keep up. But I didn't realize, my body was missing essential nutrients and I wasn't making enough testosterone.
But I wanted to circle back on they want to get their hormones tested before they started thinking about having a baby. What are you looking for?
So it just depends on what I see in their results. A lot of times it's that their progesterone is low. So there's a couple ways to balance that. One is through something called chasteberry tree extract. So it's just a supplement.
Called chasteberry?
Or Vitex is another.
Okay.
And so you can take that, and that helps to boost your own natural progesterone. If that's not enough, then you have to take progesterone from like a compounding pharmacy, typically, to get your progesterone up. A lot of times women's cortisol is high. So if your cortisol is high, which is our stress hormone, it's called the cortisol steal, where we actually convert more of our resources, more of our hormones to making cortisol than we do to actually making hormones. So it can cause our hormones to be low. It can cause men to have low testosterone. It's like that's the impact of stress on the body. We talk about stress. It's so impactful on the body, causes inflammation, and really has like significant impact.
What's a good tip for at home if someone's listening to reduce their stress? I know you can do a multitude of things, but what's the one thing that you would recommend?
So I think sleep is important. Getting a solid, good 8 to 9 hours of sleep every day is really important. Sleep is very restorative. I think if you can do nothing else, probably getting sleep is really key.
So for example, what would, for me, a female 37, what is a good range for your cortisol to be in?
It's all the ranges in the testing. You have to get the saliva test, look at the result. Yeah.
See when you took the test, right? Because you can't take it. I know when I did my blood work, I wasn't able to cold plunge right before because they said that it could just spike your cortisol.
Exactly.
Or I can't do a workout right before.
Right. I think that's another thing too. There's definitely things that I think exacerbate adrenal issues. You kind of have to look at what you're doing and how maybe that's actually increasing your stress.
So what I love about the Oura Ring is in the morning, I'll check my readiness to see how much sleep I got and what I'm prepped for the day. So that helps me. For example, today I got less sleep than I wanted to. So I wasn't going to start out with a very hard workout this morning. I did a stretch, did some breathing. I took it a lot slower. And I think just having that check-in with your body and knowing that today I can't go as hard as I thought I wanted to, that's okay. But tonight I'm going to go to bed a lot earlier and make sure that I regroup for the next day so then I can lift heavier than I wanted to.
I think some of those tools are helpful at home, right? Like if you're at home, like the Oura Ring, checking your blood pressure actually, like every night before you go to bed. Not every night, but like
on the Oura Ring?
No, I think just actually having a blood pressure cuff. Like a lot of my patients, I'll tell them to get a blood pressure cuff. They're like $30. Take your blood pressure at home and just make sure that it's normal. Make sure that your resting heart rate is where it should be. I think that the thing is like, how do you start thinking about your body differently? How do you start thinking about your health differently? In America, we literally, from the get-go, we vaccinate all our babies. We put them on formula. We put them on antibiotics for everything.
Yeah.
When they're teenagers, we put them on ADD meds. We put them on anxiety meds. We put them on antidepressants. We put them on birth control. If you have like headaches, we put them on triptans. Like we go down the route, and then all the Tylenol and Advil, like all the over-the-counter stuff, right? That we just pop all the time as if it's literally nothing. And then you get into your 20s, and then you have maybe more depression and anxiety, and maybe you go down the path of like addiction, because actually addiction is related to
All
cortisol,
the-
stress,
Endorphins.
anxiety, depression, that like if we could just back it up, like
Mhm.
let's back it up and actually let's look at like how to heal all that before that ever happens. Like let's look at all the things in like the first decade of life, like the second, the teenage years of life. Like that's kind of why I go through like this whole manual. It's like all about like every decade of life and how to start thinking about things so that you're not maybe addicted as like a 25-year-old. And then as a 30-year-old, now you're dealing with like, high blood pressure and prediabetes and ulcers. Like so many men are walking around with like these terrible gut issues, right?
Gosh.
And they're popping Tums all the time and they have acid
Yeah.
reflux and and then they have low testosterone and they don't know why and like they don't feel good, but they're just plugging along because that's what men are supposed to do. They're not supposed to actually tune in with any of their symptoms. So they just like pop a
Suppress
pill,
it.
right? And then you get into your 40s and like things are really starting to decline. And then you get into your 50s and you wonder why you're on like 10 different medications. And that's just kind of how it goes. So I think it's hard to like, I think that the point of functional medicine is not necessarily like what tips can you do at home. I mean, it's kind of a little bit about that, but like how do you start thinking about your body and your health and your symptoms and your kids' symptoms and your husband's symptoms like in a completely different way. I mean, my husband used to take like Advil all the time when I first met him. And it was just like, I don't know, you have an ache, you went running,
That's
you have
exactly
an ache.
how I was.
Like let's just pop it all the time, and you just have like a bottle.
Like it was a
and
supplement.
You have a bottle with you
It's like a
all the
1,000
time.
pill
Mhm.
bottle. Yeah.
You have, like,
we
a
did it
bottle
all
in
the
your
time.
backpack.
we would take the Tylenol extra strength,
Or
2 of them, and
ibuprofen.
be like,
Yeah.
oh, I
Just-
think I have a headache. Oh, maybe I'm dehydrated, but I'm
Yeah.
just taking Tylenol.
Yeah.
Yeah.
Like I grew up with my mom like taking Excedrin all the time when I was a kid
As if
That's
it was
for a
another
just
big one.
headache. And
1,000%.
So I think that that's like one thing at home that you could start thinking about. What are you taking? Why are you taking it? And like, how do you start thinking about that differently? Because there's major impacts to just these little things that actually we don't realize that we're doing all the time that have some serious effects down the road. And then you end up really having issues and then going to your doctor and you wonder how you got there. You don't actually realize that it was from the last 30 years, like your whole life of,
Yeah.
right? Like all the stuff that you were doing.
And I think Anthony and I having this shift into really prioritizing our health, thinking that you really don't have anything else if you don't have your health.
Mhm.
And that has just been how we invest differently in our health, how we are talking about it with our kids. You could be having the best career, the best family, but if you get sick and you're constantly dealing with these things, no matter what you're doing, you're not going to be enjoying your life.
Yeah.
It's going to be subpar. So I think it's really important the foods we eat, and that's why we do invest in making sure we're getting the right meats, we're getting the right vegetables. And I think before we didn't prioritize it. It was trying to just get whatever was quick, but not thinking about it as what is it serving our bodies and how is it.
It's like we're not eating just to feel full.
Right, we're not eating just for it to
to
taste,
supply.
just to taste good.
Yeah, we need our body to have the nutrients. And that was a completely different mind shift, but also being more in tune with our body, like you were saying, or if I did have a headache, all I did was take some of my Baja salt, which has 81 different minerals in it.
Yeah.
It's the best salt. Everyone should get it.
Put it in
But
our water.
put it a little bit in water, and within 30 minutes, my headache went away. And that was just salt and water.
But it is being, like you said, in tune with that and understanding if you don't feel good, you have an idea of, oh, I know I didn't sleep as well last night. Having those check-ins with your body, I think, is really important.
But you need to make the effort to be able to, one, educate yourself, two, to surround yourself with experts who know more than you, and three, do actionable steps to.
Yeah, because we can meet with you, and if we don't implement anything you're suggesting, I mean, you can only go, you have to take in your health. It's your responsibility too. No one's going to do it for you. You have to want it. If you want to get healthy, you have to do it. You have to want it. So I think it's really important once you find someone that's really trusted, like you, and you're giving us this advice, we're meeting with a nutritionist on your staff and taking those tips and really implementing them, I think is a huge game changer for us. And with Poppy especially, and then with Elliot, like now when he eats even better than Poppy did because I'm more aware. He's not been on antibiotics. I used to give Poppy Tylenol too. Just I'm like, oh, her tooth is coming in, give her some Tylenol. But now it's different how I'm dealing with Elliot, and it's a mind shift for me in general, thinking about his gut health. And where can someone find, if they want, or looking for a functional health doctor?
IFM.org, the Institute for Functional Medicine. So it's IFM.org. You can go on there, put in your zip code, and find someone near you. And unfortunately, there really aren't that many MDs who are in functional medicine. Hopefully that changes. But for now, it's a lot of like nurse practitioners or chiropractors or maybe something like that. But if you go to IFM.org, you can find, kind of some more people.
I love that. So if teens are having heavy periods, is that typically normal? What would be the best
solution?
Solution for that. If someone came to you with their daughter that was struggling with that.
So it starts with testing. Testing to see kind of where their balance of hormones are. Is their estrogen, typically like their estrogen would be too high relative to their progesterone. That's kind of typically what I see for young girls with having heavy periods. But I think a lot of times, moms and daughters, it's like you accept that like, oh, heavy periods are normal, or oh, having a migraine every single month is normal, or oh, having terrible cramps that like make me want to stay home and not go to school is like totally normal.
And it's not.
What
is considered a normal period, like, or a optimal range period? What are the symptoms supposed to be like that? Is this different to each person? Is it because I know a lot of skincare products, health products can be hormone disruptors. So if you're constantly using those type of disruptions in your life, how do you even know if you're that imbalanced?
Well, the period is what do they call it? Like the fifth vital sign.
The fifth vital sign,
right?
I've heard
I think that's so important.
So in high school, I know that I probably was not optimal because they were so painful and so heavy, which I just thought that's normal for, periods are like that.
Yeah.
No one told me anything differently.
So that's not normal. It should be every 20 to 30 days, last for 5 to 7 days is kind of typical. It shouldn't be super painful. It shouldn't be super heavy. So we qualify heavy as changing a pad or tampon more than once every 2 hours. If you're doing that, then that's too heavy and that's not normal. You shouldn't be having migraines. You shouldn't be having headaches. You shouldn't have like significant depression before your periods come. That's also not normal.
Really?
Yeah. I would say, looking at your diet to making sure that you're resting, making sure you're getting enough sleep, making sure that you're not overstressed. And then also too, like the toxic stuff that you brought up, like I think teenagers, you kind of just take in all this stuff, you eat however you want to eat. You are constantly exposed to whatever is in your makeup or your hair products or skin products or whatever it is. And a lot of that stuff might just be too much of a toxic burden for you. It's like one person might be exposed to that same amount of toxins, another person might be exposed to it, and then just tip them over. It's like all of our toxic burdens are different of what we can handle. So if you are having symptoms, then it tells you that like something's not right. So I think that's really that's kind of the message that I would love to kind of give is look at your body, look at how you're feeling. And if you're not feeling optimal, if you're kind of just, I think, managing symptoms, then something is off. And, how do you approach that? How do you, start looking at the way that you feel? Don't just accept all of these different symptoms that you have.
What about for skin health? Because I know in high school, too, a lot of my friends were on Accutane at the time. And now thinking back to how all of us ate and our lifestyle, but what are something, if you're seeing a ton of acne, is that something that is specifically gut health, or is that also an imbalance of their hormones?
Yeah.
It's all connected.
I would say it's a combination, but I think gut is probably the key, like probably the first place to look. The skin is really a reflection of what's happening internally. It's just a window.
Interesting.
So eczema, psoriasis, rashes, acne, anything on your skin is really just a reflection of what's happening on the inside. So the gut is the first place to start with that every single time. I think cutting out dairy first and foremost.
What
probably
about
cutting out
raw
sugar?
Because we do raw milk.
Yeah.
Wouldn't say we have really any other dairy. Parmesan cheese we do.
But that's processed a little bit differently, I think.
But overall, we don't have a ton of dairy, I would say.
But here's the thing. I would say that if you, like a teenager has symptoms, right? Like she has heavy periods, she has acne.
I see. Right.
Right? Like start
Try
to look, look at that. Like not everyone, it's kind of like that goes back to the toxic burden, which is a little bit more of an abstract concept. But like that particular teenager, something has tipped her over, right? So you've got to look at the gut. You've got to look at your diet.
You cut down sugar.
Cut out dairy. And then like all the oils, right? Like if you're eating a bunch of fried stuff.
Yeah.
But that's not typically the trajectory of how these teenage girls are treated, right? Like they go to their doctor and they're immediately put on birth control. And if that doesn't, or Accutane or Accutane is usually like the last resort. But it's not really looking at the internal kind of factors that are happening as to why she's experiencing that. And the truth is we don't get any nutrition experience in med school. We're not.
That is insane to me.
Yeah.
We don't have any education on that.
What do you mean? So you go to med school and there's just no classes on it?
No.
That is so bizarre.
So med school, we learn about how the body works. Like that's kind of the first year, right? Like you learn about your physiology, you learn about all the different systems.
Oh, and I want to note that where you went to school was at one of the blue zones.
Loma Linda.
Yes.
Which I did my preventive residency in.
So interesting.
It was fascinating. I loved it. But yeah, that's med school. That's how we learn. We learn how the body works and then what happens when it breaks down and how to fix it with medication and procedures. That's it. That's the education. We don't learn anything on menopause, hormones, reversing disease, preventing disease.
So have you always been into the proactive mindset, or through med school were you feeling there was a missing part?
Yeah, I think I always somehow was tuned in with like not taking things just to treat symptoms. I don't think I necessarily grew up with like all of that stuff all the time.
Right.
Not that my parents, were completely like wellness leaning, but yeah, I think in med school, I started to kind of understand the way that we were being taught and then got into a very conventional residency. This is kind of how I got into functional medicine and really hated every second of it and really was ready to drop out of medicine altogether, which was crazy for me. Because literally since I was 5, I wanted to be a doctor like that. And there's no one in my family who's a doctor. Like it was just me wanting to do this. And so the fact that like here I am mid-20s wanting to completely quit medicine altogether was like revolutionary. Like I didn't know what I was going to do.
Wow.
And so I quit and ended up having a friend who was in med school out at Loma Linda tell me about this amazing residency, preventive medicine, which I had never heard of a preventive medicine residency before. Like in med school, you kind of hear about all the different residencies that you can do. You can do OB, you can do internal medicine, you can do family, you can do dermatology, like all this stuff. Never heard about preventive medicine. So that just goes to show you that we're not focused on prevention.
Because it's not as much money to be made.
Well, there's in my preventive medicine residency, we never talked about medication. Not one time. We never talked about, oh yeah, take this if you have this.
And I think it's no secret to anyone listening that healthcare in America is a for-profit business. It's created with the intention to make money, to profit, which I think that's where there's a big problem in this country is it's from the business mindset. So they cannot make money off of you guys eating healthier or sleeping more and not needing a sleep aid. There's so many things that are intertwined that really makes it a conflict of interest.
Yeah. And that's why I think when people come to see me, they're like, wait, you're an MD and like, this is what you're talking about? Like,
it's so refreshing.
This is crazy. Like I've never heard of
and not
anything.
Making you think, then you don't make us feel like our symptoms are just made up.
Exactly. Right? Like that whole gaslighting that happens in medicine all the time. And I think it's a lot of maybe the reason why there's gaslighting in medicine is because the doctors don't know what to do. Like literally, like they don't know what else to do. Like, here, I'll give you this medication, I'll give you that medication. And if you say no, or if it's not working, I don't have any other tools to give you.
Do you feel like it's trending differently now that there's more information. Social media is putting out you have to be choosy as to what you're
Yes.
listening to on social
Mhm.
media, but do you feel like people are more awakened to this idea that I don't need to be on medication? I have other avenues and I can take control of my health.
Yeah, I think more so than ever before. And it's podcasts. It's, you guys talking about it. It's MDs too, like getting into this. There's kind of big ones out there. Mark Hyman, Casey Means, who I just listened to this morning. These people who've sort of left, like we've left traditional medicine.
And they're giving me all these resources on Instagram every day. You can get these tips from these top specialists. And that's what I've really filled I'm really big on muting people who don't aid in having social media be a positive place for me. And so when I'm in my feed now, it's a lot of these functional health doctors, a lot of these motivational speakers. So when I come to social media, I'm in a place to, if I'm not researching ideas to get some like fashion tips or whatever, but I'm following you. I'm following people that are giving these really good tips on there. And I feel like social media for us has been a positive place because we're learning. I mean, you can't take everything, but you have to, deep dive. But if you're following people who are reputable and pulling facts, then I think it's a really great space to be in. So I'm learning so much just in this last year of hearing podcasts, watching people's interviews. And I think it's been really helpful for us.
Yeah. Yeah. I mean, I think the more that people listen to this type of, to these conversations, but then they have to, it's like you have to digest it and you have to somehow embrace it. Like, I think that you can kind of listen to this stuff, but you can still go through like, oh, wait, all of a sudden I'm anxious or depressed. And now I'm going to go to my doctor and now she's going to prescribe like an antidepressant. Like, you can still listen to all of this. And
you have to take the steps.
You have to let it like literally change your mind because we've been so indoctrinated for so long.
1,000%.
Like the indoctrination it's like in our DNA. It's been there since like the mid 50s when, big pharma really started to take over. Like birth control coming out in the 60s. I mean, it's been passed out like candy ever since then.
Right.
That's the answer every single time. So it's like you almost have to like change our DNA.
You're going against the normal, quote unquote.
But we always say we don't want to be normal because normal is obese, pre-diabetes. Like the normal range for America
in this country nowadays.
Terrible.
Yes.
Yeah. So we do not want to be in the
polypharmacy. It's being on multiple meds. My parents are in their 80s and my dad goes to doctors all the time.
Oh my goodness.
And
so they don't see you?
Well, no. I mean, I've tried. Trust me, I've tried. But it's the indoctrination. It's like that's
they
how
don't
they
see
grew
another
up,
way,
right? Like they grew up in the 40s, like, and
that's
the 50s.
So true.
And
don't get me wrong. There's a lot of good things about certain vaccines that have been life-saving, and there's a lot of medical advances that have been really good. But you need to make an informed decision for your personal, where you're at, what decade of life you're in, and where you want to be. You have to really think of that from a personalized approach. What is something good for menopause? Someone who's maybe premenopausal. Do you recommend hormone replacement? I know that's a big thing.
I do a ton of it.
Okay.
A ton.
Because I know that's very controversial in traditional medicine.
Yes, very controversial. I have OB-GYNs who are patients of mine.
Really?
And they will even say that they don't get any education on perimenopause, menopause training in med school or residency. So you go to your gynecologist, you think that they're, going to help you through the life transition.
Someone told me that a gynecologist is a trained surgeon.
Yeah.
They're
surgeons.
They're surgeons for
surgeons.
C-sections.
Yeah.
Or also for
hysterectomies and all of that. Yeah. They're professional for sure. That's what they do. So going to see them is not, they're not necessarily going to know what to do to fix your hormones. So I do a ton of, when I started my practice, really it was just for women who.
Oh, interesting.
Who had hormone like perimenopause, 40, 50. That's who I saw. That's all. That was like my only practice was just that. That's what because I knew that there was a gap between how women, were working through their hormones and what kind of treatment they were getting. I knew that like no one was really there to help them.
For me, I'm 37. When would you say that what's like considered an optimal range to start to go through menopause? I don't even know.
Yeah, I'd say like 49, like late 40s, early 50s.
Okay,
is
so it's like
standard.
early 40s is a little out of range.
It is out of range, but again, it's if you start to have symptoms. Like I have a patient who at 37, after having her last child, went into complete full-blown menopause.
Wow.
Sorry,
full-blown.
what are the signs of menopause? I truly don't know.
Yeah. They are
Night sweats?
many symptoms that are obvious, like night sweats and hot flashes, but also not obvious at all. Like, so it's anything from hot flashes, night sweats, difficulty sleeping, foggy thinking, anxiety, depression, and then things like joint pain, fibromyalgia, autoimmune.
If I had really bad night sweats after having Poppy,
Mhm.
I don't think I had that many after Elliot. That wouldn't
Uh-huh.
have been.
It's not.
That's just like
it's
getting
like your hormones adjusting. Mm-hmm.
That was terrible though. The night sweats were really scary. I would wake up drenched, and it was just like this very anxiety feeling when I woke up.
Mm-hmm.
But that was probably just from the birth.
Low progesterone.
Mm-hmm.
So when we deliver our placenta, we are delivering our progesterone. Like our progesterone, like we're bathed in progesterone when we're pregnant. Like that's basically like what's housing the baby. Like it's an amazing hormone. So most women feel great like in the second and third trimester because they're just flooded with progesterone.
That makes sense.
And then when we deliver that progesterone out, like not all of it, but like a significant
even if you're still breastfeeding?
Breastfeeding
you still have
helps.
A little bit more.
Breastfeeding helps a lot. It helps a lot. But for women who develop anxiety, develop depression postpartum, it's because their progesterone is too low. So I see.
Interesting.
Yeah. So I mean, I think that's another population that is kind of just hanging in the balance, right? Like these postpartum women who don't know what to do.
And you think that it's because you have a new baby and you're just overwhelmed. It's lack of sleep. You're exhausted.
You're stressed. Yeah.
You would never think to get your hormones tested. I mean, at first, for me, I wouldn't have thought that.
It's almost like it's standard to have that. Yeah, right after you have a baby and the mentality of it.
I'm still nursing Elliot right now. He's almost 1. Is my progesterone still there until I'm done nursing?
Well, you make progesterone. I mean, you make more progesterone than you do estrogen and testosterone.
Okay.
Like it's our most abundant hormone.
But is it more now because I'm still nursing?
Yeah. The oxytocin and all of that that's happening is helping to balance your hormones.
Super interesting. When I weaned Poppy, I went through a really bad, I was very sad, I wouldn't know if I was depressed, but I was really emotional. I had just stopped nursing and then we had gone to Fashion Week. So I was also gone from her. I didn't know if it was just that. But when I did a deep dive afterwards, I realized I think my hormones were really off. And I don't think people talk about after you wean how your hormones are out of whack. And I wish I would have tuned in more to that. But that's one of the reasons why I'm putting off weaning Elliot is I don't even want to go into the holidays sad and that feeling. Is that something you see or was that in my head?
I mean, definitely, like that's the whole point. That's like why breastfeeding is such a natural thing. Like that's why we really need to be promoting that and supporting that as much as possible. It's really like a whole hormone balance that happens with breastfeeding, with the baby bonding, warding off depression.
It helps prevent against breast cancer, which is another reason why I really love that.
Yeah.
Just so many things that's beneficial for your body, not just the baby.
Yeah.
Which is, I don't think talked about enough.
Right. I mean, like think about postpartum. Like what kind of care do we get as women postpartum?
It's terrible.
Yeah.
Terrible.
It's all focusing on the baby. And then if you want birth control, right?
I know. You're like, wait, I can't even think about that right now. Yeah. You're just like trying to come out of the fog.
Yeah. But there's no focus on healing the mom, helping the mom.
Right.
There's none of that. So then we wonder why,
and then let alone having them think about being supported in breastfeeding at that point too. And they're like trying to get back to work after 4 weeks sometimes, which is nuts.
You had referenced your book earlier, but could you give us some more insight? Because I know it hasn't been released yet.
I'm very excited to read it.
Yeah.
So it's coming out in 2025. And it's called The Hormone Manual, a straightforward guide for every woman at every stage of life. And it's really a tool for women and men to understand, kind of what we talked about before, which is like every decade of life from the time that we're born matters, right? Like how how what happens during the first 10 years of life can affect, our health in our 20s and 30s and 40s. So it goes through that. And it's really, we have manuals for everything, right? Like we have manuals for our refrigerator, we have manuals for our car, we have manuals for our washing machine. But like we don't have a manual for our health and what to think about.
I love that.
So it's really, helping people to kind of understand how everything's connected, how our body is not just in separate systems. It's one whole system that's all connected. And when something feels off, when a symptom is happening, you've got to start thinking about other factors and how to sort of heal the whole system so that you can fix the cause, not just the symptom.
When you were saying that, it reminded me when I first was presented with the fact of getting a C-section with Jaden, no one discussed with me the importance of having the baby go through the canal for the gut health from the mom, from the vaginal canal. And poor Jaden, she has so many allergies now. And when we went through the allergy testing for her, they asked me that. Was she a C-section or vaginal birth? I'm like, why does that matter? And they were explaining that you'd have to request that from your doctor. If you had to get a C-section now, you'd have to request that vaginal seeding. I'm like, I was 20 at the time. No one talked to me about this. They talked about all the positives about the C-section and how it'd be so much easier for me with my age. That looking back now, I wish I was more informed to make that informed decision for Jaden and how it affected her. So I think that how you said it, the little decisions you do affect you into your 20s. Yeah. And I mean, she was also on antibiotics shortly after. Like all the things I did to wipe out her gut health at the time, thinking that the doctors and the pediatrician I was going to at the time was looking out for Jaden's best health, but really they were just probably checking off a checklist that they did everything that they were supposed to do. Yeah. And me not thinking I was educated enough or old enough. People were looking down. I would say I felt that judgment of, you're a young mom, you don't know what you're doing. Yeah. And I've really come into my own this time around with Poppy and Elliot of saying, this is what I see for my kids, this is what I want. And you really have to take that on as the CEO of your kids' health too, is making those decisions for them. But I just love that these little habits we do, or these everyday things, also affect them into other decades.
And I love how just even that approach, you can take that with any category in your life. With your finances, start investing now, compound annually, after 20 years or 30, you'll have that nice retirement fund. Or your relationships with your children and family, you're taking these little approaches, because those little things day by day, if you're consistently doing something positive for yourself, it's going to help you in the long term. And so I think that's really neat. The book is going to really outline the basic steps between the different periods of your life. And those little things you did in the first 10 years, see what they're equaling when you're 30 or 40. So I really love just even that aspect of you just taking that, and you can use it for different areas of your life too.
Yeah. And then I want to have more manuals after that, like a manual for men.
There we go.
Right?
I love that.
I see lots of men.
I think
love my
too, before we had switched our mindset about health, you would never want to go to the doctor. I'd be like, we need to do don't you think you're sick? You probably need antibiotics. I mean, thank goodness.
You kept on trying to push medication on me. And I'm like, I don't want to take medicine. I mean, I did take a lot of ibuprofen just because my body ached all the time.
We would go to urgent care and get
You're like, you need to get a Z-Pack. You need to do this. I'm like, no, my body can do it. It can just filter this out.
I mean, the body is like this incredible mechanism that is like kind of this perfect machine if we treat it right.
Right.
If we think about it in the right way. It is like this perfectly well-oiled machine.
I love that. And it has ways to detox on its own. You don't need to do all these crazy things. But for me, with the mycotoxins right now, we are doing a lot of extra detox. We're trying to sweat more. Yeah. Trying to figure out the source. That's a whole other topic. But in the meantime, all these things we can do to get that out. But I know my body can filter out some things. But again, if the toxic load is higher and I'm being exposed to something, it can only do so much we need to help it along.
Yeah. And I think that that's where the testing is helpful, right? Is like you figure out, okay, what's my gut doing? What are my hormones doing? What's my cortisol doing? Like, do I have low vitamin D? Like things like that. What's my iron level? Because there are reasons why you don't feel good. There are reasons why you have high blood pressure, diabetes, headaches, endometriosis, fibromyalgia. Like, don't just accept the diagnosis,
Right.
right? Like,
Do you suggest yearly testing once? I know Brittany and I, we do twice a year because
Yeah.
we implement changes, and then we always love to see the data and see like, oh, it's
we
almost like a
improve.
game for us. Yeah.
Yeah.
But do you just recommend one yearly test, full blood panel?
I think twice a year. I mean, it depends on what it is, right?
Mhm.
Like,
Because if someone's coming to her with symptoms, it's something.
Yeah.
it's a little bit
specific.
different, right? So gut testing, I think at least once a year is
Mhm.
important. It's like with the functional medicine person, I think too, like a lot of people come to see me and maybe like they think I'm going to fix them and then they're going to be off to the races and then they'll be fine. It's like this is kind of a long-term,
Yeah.
it's like part of your wellness team,
Right.
Mhm.
right? So, you know, have like this is a long-term relationship.
Mhm.
It's not just you go to your wellness doctor, they fix you and then you're fine.
Right.
Because
So-
we're so used to the medication. Be like, take the medication, you're fine, and then we go on our way. But
yeah.
And I
functional medicine.
I had talked to
is-
a functional health doctor who said that she had this mindset of she wanted to help people, but when she was actually working in a pediatrician's office,
Mhm.
and she was wanting to give them all these extra tips of what they
Yeah.
could do, and they really just wanted
Uh-huh.
the medication. So
Right.
it really depends on the person. Some people do not want to do all this extra work and
Yeah.
take this on. They want a quick fix. They don't want to change their eating.
Yeah.
They don't want anyone to tell them sugar is inflammatory.
Mhm.
They want all the things. They want to just,
continue with their life, but then have medication to kind
Right.
of suppress
So-
everything.
that's a whole, if that's you, if you're listening, that's like not something that's you're just not going to have an optimized life that way.
No. And I think that, you know, when things start to compound upon themselves, you have to realize that, like, if you just want a quick fix, like, there's going to be consequences
other side
of that,
effects.
right?
Yeah.
Yeah. I mean, people who are on medication and then they take another medication for that medication because they have side effects from the one, it's just a snowball effect.
Right. Oh my
But
gosh.
you're right. I mean, with our health and wellness, it's like it is, if you don't have your health, like
You have nothing.
You don't have anything.
Yeah.
Yeah. So I think it's important to really dive in.
Okay, so where can people find you?
My Instagram is Julie Taylor MD. My website is Julie Taylor MD. I try to keep it very simple. Thank you so much for having me. You guys are amazing. Oh my gosh.
So if you enjoyed this episode, please leave us a comment and a 5-star review. We always love to read the comments. We release an episode every Thursday on Apple and Spotify. You can find us at Brittany Xavier on all social platforms and Anthony Xavier as well.
Thank you guys.